Welcome to our educational journey into the world of kidney diseases. Today we're focusing on a rare and complex condition called fibrillary glomerulonephritis, or FGN. We'll explore what it is, how it develops, how it's diagnosed, and what treatment options are available. Understanding FGN is crucial for both patients and healthcare professionals, so let's dive in. The exact cause of fibrillary glomerulonephritis remains a mystery, making it a frustrating condition to understand and treat. It's classified as an idiopathic disease, meaning it arises spontaneously with no identifiable trigger in many cases. Some research suggests a possible link to underlying conditions like certain cancers, autoimmune disorders, or infections, but these associations are not definitively proven to be causative. Genetic predispositions are also being investigated, but no specific genes have been consistently linked to FGN. Therefore, while we have some clues, pinpointing the precise cause of FGN continues to be an area of active research. To understand FGN, we need to delve into its pathophysiology, or how the disease disrupts normal kidney function. At the heart of the problem lies the glomerulus, the kidney's filtering unit. In FGN, abnormal deposits of proteins, primarily composed of fibrils, accumulate within the glomeruli. These fibrils, which are larger than those seen in other similar conditions, disrupt the normal filtration process. This buildup leads to inflammation and scarring, damaging the glomeruli and impairing their ability to effectively filter waste and excess fluid from the blood. As the glomeruli become increasingly damaged, kidney function progressively declines, potentially leading to kidney failure. Fibrillary glomerulonephritis is a relatively rare disease. Because of its rarity and the need for kidney biopsy for diagnosis, its true prevalence and incidence are difficult to determine. Studies suggest it accounts for a small percentage of all diagnosed glomerulonephritis cases. FGN can affect individuals of all ages, but it is more commonly diagnosed in adults, particularly those in their 40s and 50s. There doesn't appear to be a significant difference in occurrence between males and females. Due to its rarity, epidemiological data are limited, and ongoing research aims to better understand the distribution and risk factors associated with FGN worldwide. The signs and symptoms of fibrillary glomerulonephritis can vary from person to person, and in the early stages, some individuals may experience no noticeable symptoms at all. As the disease progresses, common symptoms include proteinuria, which is the presence of protein in the urine, often leading to foamy urine. Edema or swelling, particularly in the legs, ankles, and around the eyes, can also occur due to fluid retention. High blood pressure or hypertension is another frequent finding. Over time, as kidney function deteriorates, individuals may experience fatigue, decreased appetite, nausea, and other symptoms associated with chronic kidney disease. In some cases, FGN can present with nephrotic syndrome, characterized by high levels of protein in the urine, low levels of protein in the blood, edema, and high cholesterol. Diagnosing fibrillary glomerulonephritis requires a comprehensive evaluation. It typically begins with a thorough medical history and physical examination. Urine tests are performed to detect proteinuria and hematuria, which is blood in the urine. Blood tests are conducted to assess kidney function, electrolyte levels, and albumin levels. The definitive diagnosis, however, relies on a kidney biopsy. A small sample of kidney tissue is examined under a microscope, and specialized staining techniques are used to identify the characteristic fibrillar deposits within the glomeruli. Electron microscopy is also crucial to confirm the presence and specific characteristics of these fibrils, distinguishing them from other glomerulonephritis subtypes. Immunofluorescence studies help rule out other immune-mediated kidney diseases. Fibrillary glomerulonephritis is generally considered a distinct entity rather than being classified into various subtypes. However, researchers are exploring variations in the composition of the fibrillar deposits and their association with specific clinical presentations. Some studies have focused on identifying specific proteins within the fibrils to potentially develop more targeted diagnostic and therapeutic approaches. While not formally classified, identifying any underlying conditions associated with FGN is essential for tailoring treatment strategies. Currently, there is no cure for fibrillary glomerulonephritis, and treatment focuses on managing symptoms and slowing the progression of kidney damage. Medications to control blood pressure, such as ACE inhibitors or ARBs, are often prescribed to protect the kidneys. Diuretics may be used to reduce edema. Immunosuppressive therapies, such as corticosteroids and cyclophosphamide, are sometimes used to reduce inflammation and immune system activity, although their effectiveness in FGN is variable and not definitively proven. Statins may be prescribed to lower cholesterol levels, particularly in patients with nephrotic syndrome. Dietary modifications, such as limiting sodium and protein intake, may also be recommended. In advanced cases, when kidney failure develops, dialysis or kidney transplantation may be necessary. Because the exact cause of fibrillary glomerulonephritis is largely unknown, there are currently no specific preventive measures. However, maintaining a healthy lifestyle, including a balanced diet, regular exercise, and avoiding smoking, may help support overall kidney health. If an underlying condition is identified as a possible contributor to FGN, managing that condition effectively may potentially reduce the risk. Further research is needed to identify potential risk factors and develop targeted prevention strategies. The prognosis for individuals with fibrillary glomerulonephritis can vary. The disease often progresses to end-stage renal disease, requiring dialysis or kidney transplantation, but the rate of progression varies significantly among individuals. Some individuals experience a relatively slow decline in kidney function over many years, while others progress more rapidly. Recent research efforts are focused on understanding the composition and formation of the fibrils in FGN, identifying potential therapeutic targets, and developing more effective treatments. Studies are also exploring the role of genetics and immune system abnormalities in the pathogenesis of the disease. Ongoing clinical trials are evaluating the efficacy of novel immunosuppressive agents and other therapies in slowing the progression of FGN and improving patient outcomes. These advances offer hope for more effective management of this challenging condition in the future.